And good morning. Today, the rising popularity of Mahjong.
Plus, debunking fertility myths and giving couples the chance to conceive.
And how some of Wisconsin's most recognized artists are helping Alzheimer's patients.
It's all next on The Morning Blend.
It's a great day, so make it everything you want it to be. It's yours and it's mine. It's a great day to shine.
Well, there are many myths surrounding fertility. After the break, fact and fiction when it comes to getting pregnant when we come back. And welcome back. Well, there are a lot of infertility myths out there. We've been talking about a few of them during the break, and having the wrong information can hurt your chances of conceiving.
Yeah, for sure. And Dr. Ellen Hayes is here with Aurora Fertility Services. Dr. Hayes was recently listed in the February Milwaukee Magazine Top Doctors issue, and that's one edition of the magazine I always read because I think everybody likes to go there and go, oh, my doctor's on that list.
Right.
So congratulations
Well,
to
thank
you
very much.
for that. It's nice to have you here, and I think it's a great topic for us to talk about myths, because especially as women get a little bit older, and by a little bit older, we're even talking maybe early 30s, late 30s, 40s.
Correct.
They have some misconceptions about conceiving and getting pregnant. So let's start by talking about the fact that you probably have a lot of women who come to you with those misconceptions, right?
I do, because it's sometimes misconceptions. The patients have just made assumptions on their own. Other times it's information they get from family or friends, because obviously when someone's having trouble conceiving, everyone wants to try to help. So they tell them what they've heard. And so sometimes this information is just passed on and on.
And everyone has an opinion. You've got a list of 5 true myths that we want to go through. And the first one is that infertility is a woman's problem. That's a myth.
I think
That's
men
a
would
myth.
like to think that.
Yes.
Right. And women tend to blame themselves. If they
Yeah.
don't know what the situation is, they tend to take responsibility for the situation. So actually 40% of the time it's a male factor issue.
Really?
40% of the time female, and about 20% of the time it's unexplained.
Okay, so it's kind of equal, which is probably good for the couple to feel like they're kind of in it together and that
Right,
it's equal.
right.
And through testing, you're probably able to determine if it's either a male problem or a female problem that
Or
you can
both.
work toward, or both, that you can work toward addressing.
Correct.
The second myth is, as long as a woman is having regular periods, she's fertile. Not true, right?
Not necessarily true. Regular periods tell me that the ovaries are producing hormones, that the woman may actually be ovulating or releasing an egg on a regular basis, but it doesn't tell us anything about the quality of the eggs that are left in the ovaries or the eggs that she's releasing. And a lot of those eggs might not be capable of producing a pregnancy.
Okay.
So we have to specifically test for that.
Okay. The next one we were talking about during the break and saying, you know, I think Hollywood in part is responsible somewhat for this myth because it glamorizes pregnancies after 40. And your myth is that women over 40, as long as they're healthy, should be able to conceive. Now, that's not always true.
It's not always true because, again, as we get older, we don't feel old, but our eggs start to age. And so sometime, for most women in the late 30s to early 40s, they'll reach a point where the egg quality is becoming more of a problem. And over 2/3 of women around the age of 40 actually need assistance getting pregnant.
Yeah, and
big number.
isn't 35 the age where you consider to be advanced maternal age?
That's correct. That's
Which
correct.
is
An
shocking.
elderly pregnancy.
Yes,
You're
yes.
elderly.
We don't like to portray it that way
I'm nearing
because
that.
there's plenty of pregnant women.
women.
Plenty of pregnant women in their later 30s, early 40s, but it just becomes more difficult.
Yeah. Now, the next one then is if a woman was able to conceive once, she'll have no problem conceiving again. So just because you've had a pregnancy or had a child doesn't necessarily mean you'll be able to conceive again. That secondary infertility can be almost as frustrating.
Right, right. And so secondary infertility means that the couple or the woman has had a previous biological child. So most people assume it won't be an issue, but past fertility doesn't ensure future fertility because, again, time has passed, things can change health-wise. So the same standards, you know, if you're over 35, if it's been 6 months of trying, go see somebody. Less than 35, a year of trying, go see someone for an opinion.
That's a good rule of thumb to follow for a time frame.
Yeah.
This next one, I think everyone who has someone who's had trouble conceiving has heard this statement, and it's that it seems like everyone else can get pregnant by the drop of a hat.
Correct. And I think that's natural for couples to feel that way when they themselves are having problems. Actually, it's about 10 to 15% of reproductive age couples that have difficulty conceiving. So that equates to millions of couples in the U.S.
Yeah, because it's an isolating feeling, especially if you walk past a playground or a school or a nursery or something like that.
Or family gatherings, all kinds of things are very isolating. But don't feel like you're alone, because it's millions of couples that are in the same situation. The important thing is just to seek help.
And speaking of that, at Aurora, patients can have all of their fertility questions answered. I know you can get a complete evaluation of both the man and the woman, get a customized plan. You also have that IVF Shared Success program, and this sort of reduces that financial pressure because it makes it predictable. So 70% of the set fee can be refunded, right, if you do not achieve the dream of delivering a baby, not just getting pregnant, but having a baby, right?
That's right. That's the important difference, is if you don't deliver a baby, then you get the refund. It's not just getting a positive pregnancy test. We want you to have a child as a result, and so the refund would be given.
It's wonderful.
I know you also have an egg donor program that people can call and find more information about as well. So if you have any questions on fertility or any of these infertility myths, or you want to see Dr. Ellen Hayes, here's the information that you can call right now for Aurora. It's 877-358-0833, or their website, aurora.org/fertility, for more information as well. Thanks so much, Dr. Hayes.
Thank you very much.
Nice to have you back.
Great
Thank you.
conversation.